New mothers and children are the subject of a historic investment for the state of Missouri. Now, Missouri has one of the highest rates of pregnancy-related deaths in the United States, so they're putting money into their maternal mortality prevention plan. Our Missouri Chief Capitol Bureau reporter Emily Manley in Jefferson City with why the state is struggling.
In a new report from the state, an average of 70 women died while either pregnant or within 1 year after giving birth from 2018 to 2020. The Missouri Hospital Association says the most sobering piece of that report is that nearly 85% of those deaths were preventable.
Maternal mortality rates in Missouri are not great. We're well below the national average, and we know that's something that we need to improve on.
Missouri is looking at new ways to help save new moms.
And I think that's why we did the appropriations this year. We think it's one of the largest investments, trying to really change the needle in that, not just kind of go out there and just talk about it.
According to a recent report from the state's Pregnancy-Associated Mortality Review Board, the #1 cause of pregnancy-related deaths are mental health conditions, including substance use disorders.
The highest occurrence of these deaths happen between 43 days and 365 days postpartum. So it's not even that we're seeing these deaths occur during pregnancy, during childbirth, or even immediately after childbirth.
The second leading cause, cardiovascular disease, like high blood pressure.
But one thing we are seeing is that Black women have a 3 times higher instance of maternal mortality than white women.
Last week, a new law went into effect extending Medicaid coverage for new moms for up to 1 year after the baby is born, giving help to 4,200 women a year.
We know that healthcare access is critical, right? I mean, if you don't have insurance, you're probably a lot less likely to seek prenatal care, to continue seeking care postpartum.
The report shows that before expanding coverage, women on Medicaid in Missouri were 10 times more likely to die within 1 year of pregnancy than new moms on private insurance. The state is also spending more than $4 million to create a maternal mortality prevention plan.
And we can do better. And I thought if there was ever a time to spend money when we spend a lot of money, what better way to spend it on mothers and children? And you're trying to really save people's lives.
The report also found that women living in metropolitan counties are twice as likely to die by a pregnancy-related death than women in rural counties. Reporting from Missouri Capitol Bureau, I'm Emily Manley.